When you think of hair transplantation, most people associate with a male-oriented procedure. But actually, over the last few years, that has changed. This is Dr. Jones, and he's an expert in hair transplantation. Have I said that correctly?
Well, yeah, hair transplantation or hair restoration.
Hair restoration. So, Dr. Jones, I understand that you have actually had a hair transplant.
I have. About 2 years ago, I had a few thousand grafts put in. As you can see, this is transplanted hair, and it looks as natural as a normal head of hair.
Absolutely, no cornrows.
Unfortunately, when most people think of hair transplants, they think of the type that were done in the 80s and 90s because that's what they see. Now, these days we do it all hair by hair, and it looks as natural as a normal head of hair.
Yes, that's good. We were speaking, and you were mentioning to me that you have between 20 and 30% of your patients that are female.
Yeah, a female hair loss is actually much more devastating than male pattern baldness because a male that's losing his hair, it's not a huge issue because it's normal
accepted in
society.
But for women, it's not accepted socially.
No, it isn't.
Now, this is Charlotte. Charlotte, give us a little wave there. Now, this is interesting what we're going to be doing with Charlotte today because she's obviously a young woman and she's got a scar here, right?
Yeah.
Explain a little bit about that.
She has a scar in her hairline, and with this scar here, she's limited in her hairstyle. She's not able to wear her back.
Right? Yeah.
She's got to wear her hair forward. So what we're going to do today is harvest hair from the back of her head and plant single hair grafts right into this scar. When we take the grafts out, what we'll do is just take basically hair by hair with a tiny punch. The traditional way of doing a hair transplant is to take a strip out of the back.
Yes.
And the way we're doing it now is, again, this new technique that I developed is called follicular unit extraction. And what we do is fit a tiny punch over the hair, remove the graft, and in that way we don't have to use a scalpel or put sutures in afterwards. It's not for everybody, but in certain cases, especially like Charlotte, this is perfect.
When women come in, is it usually related to, is it female pattern baldness? What's the correct term?
Well, female pattern baldness is probably the most common cause, but we also see patients for other reasons. One would be a scar like this. The other is quite often after facelifts, women will have a scar behind their ear.
Right.
And they'll have some hair loss right behind their ear and a scar here, which you can put.
What about recovery? What does she do after she walks out of here?
She's going back to work tomorrow because she'll be able to style her hair on the front to cover this area up. You won't see anything in the back because her hair is so long. And she can go back to work the next day.
And then it takes how long for that to grow in?
It sheds in about 3 to 4 weeks and starts to grow in about 10 to 12 weeks. So you don't get the final result for sort of 8 or 9 months after.
Okay. All right, good. All right, well, let's get started. Can't wait to see this.
Okay. The first part of the procedure is, again, just making the recipient sites. So what we're going to do is numb this area.
Okay, right where the scar is.
Where the scar is, and I'll make the recipient sites.
When you say to make recipient sites, what does that mean exactly?
Just make holes. Now the next step is to retrieve the grafts.
So this is now the last part of the procedure, right? Where the actual hair grafts are going into the little holes, if I said that correctly.
So what we've done is just extracted these follicles from the back, and we made little pockets in the front. And so what Trisha's doing is just putting each of the grafts into a separate pocket in the front.
Now, what else can people do there's a lot of women that have thinning hair overall. Are there any other tricks of the trade you can give us,
Well,
Dr.
another
Jones?
product that's been out for a few years now is microkeratin fibers.
Microkeratin fibers.
Protein fibers. So it's basically made from the same thing that hair is made, only they're just about 2 millimeters, 1 or 2 millimeters long.
Okay.
And what they do is through electrostatic forces, they stick to your existing hair, making it look thicker. So what you do is you just shake it on your hair.
Oh my
and
goodness,
then just rub it in, and what it'll do is thicken up your hair instantly.
Now, does it come out?
The only way to really get it out is to shampoo.
Okay, so these little fibers stick to your hair and just thickens the whole thing.
That's right.
Yeah, look at that. That's great. That's great. That's great. Well, thank you so much. Thanks for allowing us to come in and see this experience. Thank you, Charlotte.